Hi, good evening. My name is Christy Moyer, and I will be presenting on insomnia. As a nurse case manager who speaks to veterans daily telephonically, my experience has been that 70% of those who've been deployed experience PTSD, depression, nightmares, and chronic insomnia. By completing this assignment, it has aided me in how to better educate the veterans who are struggling with chronic insomnia and to educate them on the evidence-based research. My hope is that by sharing the results of the evidence-based research with my colleagues and my patients, it will better help them in return, especially the veterans, to decrease insomnia. Adults really do need 7 to 9 hours of sleep each night to ensure optimal physical and mental functioning. Those who think the rules do not apply to them, research proves they are simply wrong. Insomnia leads to daytime drowsiness, and insomnia affects our health in many ways, such as daytime irritability. It decreases our immune system. It increases levels of inflammation. It decreases the pain threshold, and it can increase aging, our risk for diabetes, obesity, and hypertension. My original PCOT question was, in patients who are veterans with PTSD, what is the effect of using a weighted blanket on the effects of sleep compared with not using a weighted blanket within 1 month time? However, I was not able to find enough research on this topic, and so I needed to change my PCOT question. And my new question was, in patients with insomnia, what is the effect of using non-pharmacological interventions on the effects of sleep compared with non-pharmacological interventions within 1 month? I chose 1 month because I felt like it would give enough time, because there's usually like a week period of time for people to adjust to anything new, especially if they're trying something new, and that a month's time should give them an opportunity for the new device or whatever they were trying to kick in. This is the synthesis of literature, which consisted of 6 studies. There was 3 pilot studies. There was a quantitative randomized controlled trial, and then there was a descriptive design study. I dug deeper into the literature. Some of the studies had pages of references that I was able to find more studies then as well. But my initial search strategy and prism flow diagram consisted of using this University of St. Augustine library, and I found 26 citations. I used the words veteran, PTSD, insomnia, and I searched on the last 5 to 7 years. Excuse me. There was 14 articles that were excluded after title abstract, and there was 12 articles retrieved, and I did end up keeping all those 12 articles. So the evidence and research, Ekman et al. 2017 educated veterans to avoid caffeine, to avoid tobacco, alcohol, and only sleep in bed and have sex in bed. They were not to watch TV in bed or try and fall asleep to the TV. If they couldn't sleep, they were to get up and move to a different room. They needed to exercise daily and to eat healthy. The veterans were also told not to nap during the daytime to help improve sleep during the night. Moreover, the veterans were also go to sleep at the same time every night and to wake up the same time every morning. The bedroom they slept in should be maintained at a cool temperature of between 62 to 68 degrees Fahrenheit. And lastly, it was also recommended that after the alarm goes off in the morning, they needed to get out of bed within 5 minutes. And this study did result in a reduced insomnia and improved the ability for the veterans to take part in social roles. The next study was a pilot study which was conducted using a 30-pound weighted blanket, was used in a controlled environment of a locked unit at a mental health institution. And it used self-rating results, which showed that 66.7% of the participants found that the 30-pound weighted blanket was effective in reducing anxiety. 20% indicated no change in reducing anxiety, and 13% had a negative effect. The study concluded that the weighted blanket was 100% safe and 60% effective for those adults with mental illness. A larger study, varied populations, and client-centered evidence-based weighted blanket practice guidelines that inherently promote client-centeredness are recommended. The study, a two-tailed t-test, was used with level of significance set at a p-value of 0.05, and the 30-pound weighted blanket did not cause an adverse effect on the vital signs collected and was safe to use. Another study looked at a randomized controlled trial, determined more education for non-clinicians, sleep coaches, on a structured, manual-based cognitive behavioral therapy for insomnia program to help veterans with insomnia. Baseline differences between the treatment group and the control groups were assessed using two sample t-tests for continuous variables and a chi-square test for the categorical variables. Another author reported that participants slept between 1 and 3 hours a night more with the use of a weighted blanket, and it also decreased the amount of time that it took for those participants to fall asleep. Epstein the author also gave a descriptive design study, determined the accessibility of insomnia treatments and preferences for the interventions and treatment delivery characteristics among veterans and their healthcare providers. Many veterans with more than one deployment often suffer with PTSD, depression, and the need to be screened for traumatic brain injury. Relaxation therapy was the veteran's preference for assisting with sleep. Further studies testing insomnia and nightmare intervention are needed. Things that did not help insomnia that was surprising to me in some ways was that deep breathing techniques nor drinking chamomile tea did not offer or assist with adults with insomnia to fall asleep faster or sleep longer. Gutman et al. Reported iRest meditation group experienced more sleep time than the Dream Pad pillow and the sleep hygiene group. The Dream Pad pillows played soothing, relaxing music to aid with sleep. Yoga and deep breathing exercises also did not increase sleep. I chose the ARCC model because it has been a popular model used in the healthcare system and has improved patient outcomes and quality of care, according to Malek et al. It has also been used in the United States and has been an accepted model. I like that the evidence-based practice incorporates and embraces change for the better, teamwork within an organization, and recommends mentors. My company started encouraging mentors within the past 2 years. Also, I like that it not only wants the evidence to improve quality, but it also looks at the cost effectiveness of the evidence-based practice. So the author reported that the ARCC model reports that greater implementation of the evidence-based practice results in higher job satisfaction, lower turnover rate, and better patient outcomes. Newhouse reported that nurses engaged in evidence-based practice must begin to incorporate economic metrics and evaluate the cost impact of recommendations implemented. The evaluation. Kessler et al. Reports that data on the reliability and the validity of a new fully structured measure of insomnia that was developed for use in the America Insomnia Survey, a large epidemiologic survey of the prevalence, and it correlates of insomnia in a sample of subscribers to a large national managed healthcare plan in the United States. This brief insomnia questionnaire was designed to be administered by an interviewer. This tool is known to be reliable and it has been used over the telephone in the past. Then ask if the weighted blanket has been used and if it has improved their length of sleep. So that's how I would plan to do my evaluation. As far as analysis, I would use Microsoft Excel, and a pre-post comparison would be used, since looking at if a weighted blanket assisted veterans with insomnia to have improved sleep or not. Dissemination of the information. Institutionally in my company, I would provide the information to my manager and my teammates in a staff meeting. And if information was well received, I hopefully could email or provide a PowerPoint presentation to email out to the nurses in my department. The nursing leaders within the company have virtual lunch and learns, and they also offer continuing education credits. So that would be a wonderful venue to try and share this information as well in my company. Locally, it would be wonderful to share at the 2020 Philadelphia Sleep Conference in September 21st, 2020, since I live about an hour away from Philadelphia, Pennsylvania. The Sleep 2020 34th Annual Meeting of the APSS is also June 13th through the 17th in Philadelphia, and that joint venue of the American Academy of Sleep Medicine and the Sleep Research Society and the annual sleep meeting of the Associated Professional Sleep Societies is the premier clinical and scientific meeting in the sleep field, bringing together 5,000 sleep medicine physicians, sleep and circadian scientists, and other healthcare professionals to discuss the latest advances in sleep science and new developments in the diagnosis and treatment of sleep disorders. Nationally, I would look into possibly being able to submit my research or information to the Sleep Health Journal of the National Sleep Foundation, which is a new multidisciplinary journal that explores sleep's role in population health and elicits the social science perspective on sleep and health. Aligned with the National Sleep Foundation's global authoritative evidence-based voice for sleep health, and the journal serves as the foremost publication and is mainly there to advance the sleep health in that society. My conclusion would be that more research needs to be completed using pharmacological therapy with patients with insomnia, and especially in veterans with nightmares and PTSD. My recommendation would be to share evidence-based practice information with colleagues and patients with insomnia, and to continue to conduct and prove evidence-based practice. My next 3 pages contain all my references, and I thank you for your time, and I definitely your feedback. Have a good evening. Thank you.